Welcome, and thank you for joining us on this historic day to celebrate the opening of this beautiful new facility for children. You'll notice as you enter the building that we have chosen the theme, Discovering New Horizons. That theme is important because it represents the future of our society and the next generation of children who will receive care here. In 1855, the first children's hospital in America was opened in Philadelphia, and soon other children's hospitals followed across the country. And in 1922, the Church of Jesus Christ of Latter-day Saints opened the doors of Primary Children's Hospital. I am humbled by the generosity of every donor. Contributions large and small have made this beautiful building possible today. And I'm honored to have colleagues, physicians, and employees who, like me, feel a real part of the legacy of Primary Children's Hospital and are committed to always keeping the child first and always.
Primary Children's Hospital has deep meaning for me for many reasons. But my greatest connection that really connected my heart with primary didn't come as I walked the halls as a physician. It came about 15 years after I'd been in practice. I was still what I thought was a young physician, but I thought I really understood what it meant to the patients to connect with them and what it felt like to be a patient. But I didn't really truly understand that until I entered the Primary Children's Hospital here as a parent of a very sick young child. That had such a tremendous impact on me as I felt a degree of vulnerability that I never expected to have. And I sensed the true caring, and I had such great appreciation for the extraordinary clinical expertise of those who cared for our son.
Several years ago, before shovels broke ground for this wonderful building, Primary Children's Hospital undertook a community survey to assess what kind of support there would be for a capital campaign. I happened to be one of the many local community members to be interviewed. After I answered several of the interview questions, I had a question for the interviewer. What kind of responses have you received? I asked. I do this kind of work all over the country, the interviewer responded, and I have never seen such community support for an institution as I have seen for Primary Children's Hospital.
Now, it seems impossible that nearly 25 years ago have gone since that move to what I still consider the new Primary Children's Hospital here on the East Bench, overlooking this beautiful Salt Lake Valley. Certainly, we share your excitement for what this wonderful new outpatient service building is going to offer our citizens. And I know if Uncle George and Aunt Lily were here with us, they would say, what an honor it is that this building will bear our names.
I'd like to tell you an experience that we had with a surgeon that many of you know well, Dr. John Hawkins. And it was a Saturday morning. Alex was 8 days old. And we prepared for a surgery and weren't sure if he would make it through. Well, the worst thing that could happen happened, and that was that we as parents realized or found out that there was a baby being flown to the hospital on the helicopter who needed surgery worse than Alex. About 9 o'clock or 10 o'clock that night, Dr. Hawkins came in Alex's room, and with Bryn and I in there, he sat in a rocking chair, and he looked me in the eyes and he said, "Dad, what do you want me to do? Would you like me to do the surgery tonight?" We told him, "You're the doctor. You tell us." His answer was this. He said, "In medical school, they make us stay up 3 days straight to prove that we have what it takes to do surgery at any time." He said, "But I think it'd be nice to have a fresh team in the morning." And so at 9 days old on a Sunday morning, Dr. Hawkins and his team operated on our boy. That experience will forever remain with us as a testament of what these wonderful surgeons and caretakers do for our children.
Two and a half.